that thing for me.
Yeah, at 20, about 5 minutes.
At 20 after.
Yeah.
Just 20 after.
Okay, give blocking out.
God forbid.
God forbid.
Good to see you, Big.
Have a nice day, Bill.
I will.
Make sure I don't block you out. Welcome, welcome, welcome. Welcome to Truth, a radio program designed with you in mind, a program whose sole purpose is to empower you, our listener, for information leads to knowledge, and knowledge is, you got it, power. And as always, I want to empower you to take control of your life, those things that impact you, your family, and your community. As always, too, I want you to go to the website at www.gwen-truth.com so you can access all of those powerful resources that will allow you to be what? All powerful, because information is power. So as always, I do encourage you to go to our website, and go to the website too so that you can chime in on the query that we have going, and that query is asking about pensions. Pensions for individuals who are in government who retire, and they're actually ending up making some, not all, but some, making a ridiculous amount of pension benefits, and that's on your dime. You're the taxpayer. So go there and chime in on that query. And we're doing shout outs to all of you. I hope everyone had a happy, happy Valentine's Day. I also hope that you took the time to share love with somebody, okay? Somebody, is associated with you, not associated with somebody else. The world does need more love, so happy Valentine's Day to everyone. And I want to do a shout out to Bethune-Cookman University and the Larry Hanfield Center, which with the Board of Counselors, we had an opportunity to tour that facility, and an opportunity to go through the walk, the Legacy Walk of Fame, and see all of the start with Dr. Mary McLeod Bethune, and to finish right now with the interim president of Bethune-Cookman University, who of course is Dr. Edison Jackson, and then all of the coaches from one point to the next. And of course we have the current coach, Coach Jenkins, with the football team, but they now have so many different sports, and so many individuals too who are tied in, a part of the great Bethune-Cookman University. So shout out to Larry Hanfield, who made that possible, along with some others, but majorly him. That's why his name is on the building. And it is a first class center, first class operation, and you really and truly do want to go and tour that facility. And Harold Lucas, of course, who was recently had an area on a playing field, recreational area, named after him, is and does have naming rights for the reception area in that building, and all of it is just plain gorgeous. Gorgeous, gorgeous, gorgeous. So do avail yourself of that. So shout out to everyone who was a part of that. Shout out to all of you, our listeners. Shout out, shout out, shout out. We want to share some love, right? Now today we have the great privilege and opportunity to talk about some programs that we read about, we hear about on the news, especially with the sequestration that they're talking about possibly going on and possible impact of that and everything in terms of Social Security and Medicare. And we want to share some queries that are going on in terms of those two programs, and you know, do some general talking as well, because we know that especially for Volusia County, we have a large number of elder, I'm a part of that population, Bill is too, elder individuals, and we make up a large portion of the population, but we also help to provide that foundation, that fiscal foundation for various governments as well. And I know in Volusia County you're talking about a base foundation of a good $1 billion in terms of funds that come in based on pensions and other retirement forms like Social Security and the like. So persons like myself who are in my age category are actually helping the government. We're not hurting local, county, state, or national governments. We actually are helping by income. And that's that little test that we do to make sure that everything's operating as it should at WELE, 1380 AM on your radio down in Ormond Beach, Florida. As has been stated, I'm Gwen Azama-Edwards, former city commissioner, retired city clerk, city of Daytona Beach, and president and CEO of AE Enterprises, Inc., a consulting firm on politics and ethics. Again, my guest is Bill Ternent. And Bill is, I never get his title right, but I always want to call him the legislative liaison coordinator for the Volusia County area. And you may cover more than that, Bill, but he is the knowledgeable person who always comes to our AARP meetings and not only shares information with us concerning what's happening as far as the elder community is concerned, as it relates to Medicare and Social Security and other elder issues, because he is a spokesman with AARP. I assist from time to time, have had that training, but Bill is continually trained and continually provided with updated information as to what's going on. So we want to always make sure that that he is in the, not only, we know that he's in the know, but we want to make sure that that information that he knows about, that he's knowledgeable of, is shared throughout our communities as well. So shout out to my guest for tonight, who is Bill Ternent. And Bill, what is your specific title as now as relates to AARP? And you have your hands in really quite a few areas. So if you could kind of share that with my listeners as we then start to get into some other information in terms of the survey you're doing and some other things that are in the hopper as far as the elder programs are concerned.
Okay. Delighted to be with you again, Gwen. The things I do, one of them is called an advocacy coordinator for the congressional district that is in this area.
Wonderful.
Okay, that's one. Another thing that I do, I'm basically just a volunteer. I'm a retired person who decided that it was important to volunteer with AARP because I looked out there and I couldn't find another organization that would be nearly as effective in dealing with the needs and defending the purposes and needs that elders are, well, they're constantly faced with challenges of what's going on in life.
Absolutely.
And they're constantly being faced with challenges related to the benefits that they receive in various programs.
Mm-hmm.
Right now, of course, and this has been going on for now several years, and it'll go on probably, I would guess, for another 2 at least. And that is dealing with the issues of Medicare, which I don't think we'll probably do too much talking about tonight. We can do that maybe another time. But the big one that is coming up that's, I think, pretty much on everyone's mind, and that is the recognition that down the road, not yet, okay, off another 15 or so years, or 8, 10 years, 30 years, whatever you want to, whatever figures you want to look at, that says Social Security is going to run out of money to an extent, okay, unless something is done to deal with the program. Now, this was done 2-3 decades ago, which has gotten us this far down the pike with no problems. But the recognition is that unless something is done in the next 15 years or so, we're going to be in a position where the federal government will only have enough money coming into Social Security in order to be able to pay between 70 and 80% of the kinds of retirement benefits or other benefits that people receive now. So it needs to be dealt with. AARP, in response to that, both in terms of Social Security and Medicare, decided to go into a program. And this is particularly true with Social Security. You've earned a say. Everyone who is in Social Security has earned a say. It's your dollars, my dollars, everyone who works dollars who go into Social Security. And so you ought to have a say in what's going to happen about fixing this program.
Absolutely.
And about the only things we've been hearing are the kinds of things that are on the minds of one legislator or another, and they're across the board. They run from the very, very conservative to the very, very liberal to the independent, and every position that you can think of in
Everybody has
between.
an opinion, right?
But there are a number of these that have been are being talked about more than others, and AARP decided to take those and pull them together and put them down in some words that people could take a look at, and they could understand what kind of an impact that a different kind of fixes of the system, if you would, what kind of impact that would have on the discrepancy that's expected to come down, i.e. the shortfall down the road.
Can I share real quick, Bill, just in case there are some people who don't know, that it was in 1935 that it says Democrats and President Franklin Roosevelt created Social Security. And then in 1965, 30 years later, Democrats and President Lyndon Johnson created Medicare. Now the reason this says it that way is I was looking for some historical information. This came off of a Democratic, site. So, but the legislature created the Social Security, enacted Social Security in 1935, and then Medicare they created in 65.
Remember,
so it's been a while.
Remember, they are two distinctly separate programs.
Two separate programs.
Distinctly separate programs. And then on down the pike a little bit from that, as I mentioned, there were some changes made in the Social Security system, which took it from a retirement age of 65 and over a period of a number of years have moved it up to 66, and soon it will become 67 for the full retirement. And of course, there has always been in that the ability to retire early at 62 with a lesser benefit than you would receive if you stayed in until full retirement age. Okay?
Right, so, absolutely.
So I was down yesterday down in Deltona talking with some folks in the assisted living facility. I talked with a number of folks in a lot of different organizations about this, and in essence, I took this brochure, I gave you a copy of it over there, and we took these things one by one, and because these are the major fixes that are being talked about by various legislators in Washington. These are the kind of things you expect to see being put into language that appear in the House and appear in the Senate, that go through the process. Now there might be some that are added in the future, but we can't deal with what we don't know about. But these are a pretty broad spectrum, and I think in the process of talking about these, we can also get a pretty good idea of what the problems are and what are the potential different solutions that could be dealt with.
And I think we should mention here, because I shared with Bill a public policy, Solutions to Social Security Medicare Financial Problems, public policy monograph that was done in the spring of 1996. And a lot of the same solutions that we're talking about now, we're talking about 16 years plus ago, but a lot of the same solutions that they talked about then are the same solutions they're talking about now. And there's never been the political strength to actually go ahead and tackle the problem. In fact, I would suppose that really over the years they've been talking about what to do to resolve the issue before we get to the point of where we're almost now. And there's not been that courage to go ahead and tackle it. So we've gotten closer and closer and closer to where they say it would be not a doomsday, but a reckoning in terms of those who are receiving and those who are paying in. And as a result, especially with AARP taking this up and trying to not be just a body representing the millions of individuals that they do represent, but not to go over there and just say what we don't want, but to share in the solution and the problem solving of what we can live with or what we do feel is a viable solution. And I think, Bill, I would share too that what is a good thing about what AARP is doing, as you've shared, is that they're going out to the community, they're talking to elders and getting their input in terms of what they feel is a good, plausible solution and what isn't.
That's exactly right. This brochure that you and I are going to be
Yes,
talking out of
yes.
here. I take these out and I get people to answer, to respond to the answers that are available in this. All of that information gets reported out through our state office over, AARP office over in St. Petersburg, ends up in Washington, is pulled together there from across the United States, and then that information is made available to the legislators, our congresspersons, our senators, so that they know what it is that a lot of people across the country think about the solutions that they're suggesting.
Right, so they can't say they haven't heard from the people, they can't say they don't know what they're thinking, what it is that the elder community wants or believes would be viable, because AARP is collecting that information and then they will be sharing that information with the decision makers.
That's right. That's it. Let's hit the first one of the. Oh, maybe it might be worthwhile to say a couple of things about Social Security.
Yes,
because,
yes.
I'm sure that most folks are aware of these things, but maybe not.
And we will say that there's a lot of misinformation out there. That's another reason I'm having Bill on here, because number one, I trust him to share factual information. He is required as a representative of AARP to share factual information. And this is information that they have pulled together. It's based on not only what they have been told in the field, but they also share information with you guys about the reality of what is going on as far as the legislature is concerned, the reality of what's going on as far as what those who have scientifically and made database studies have said is going on and will be the case as they project forward. So what you are told and receive through training and what you share are those things that are factual. But the other side of it is that what you are going out in the field along with others and doing is that you're really making this a bottoms up type of problem solving and data gathering.
Certainly trying to.
Yes.
If you think about Social Security, when it started out, there was a pot with no money in it. Okay. In order to get some money in it, because Social Security was envisioned as being a program that was a pay-as-you-go program, that as people paid in through their payroll deductions for Social Security, those funds could be used to pay those folks who were to receive funds. Okay. Well, obviously, when this thing started out, there weren't an awful lot of people receiving funds, but there were quite a few persons for every one of those persons who could be receiving funds who were working to fill that. So where you had, let's say, 20 persons filling the needs of one person in this pay-as-you-go program at one point in time, now it's down to the point where it's onesies, twosies, threesies. Okay. And that's one of the reasons why we end up having these fiscal problems, that we need to redo the program, make modifications in the program, so that there are enough funds coming into the program in order to cover the folks, the outlay in the program. Now, obviously, back from the beginning, okay, there was no money in the pot to begin with. But with very few people at the very beginning receiving funds, okay, in fact, None, because nothing had been paid in, and they had never, you receive based upon what it is you put into the program, okay? So the pot grew, and then the pot grew to the point where, well, we've got more money coming in than we're using, what do we do with that? Well, a trust fund, you've heard about the trust fund, was created where those extra funds were to go, okay? And then they would be there when they would be required later on, as there was more demand for payout for the system. And then as it went on down the line, the decision was made in the Congress to invest those funds in what is considered to be the most, at least then, and I think probably still, the most safest investment in the world, and that's in the full faith and credit of the United States government, okay? And so this pot of money became then available to Congress, and Congress did not avoid using money out of that pot when they decided they didn't have enough coming in from taxes or from other sources, and would borrow from that trust fund, and that probably has contributed a deal to the fiscal problems that we have now. The point is that those funds have gone out, and now when it gets to the point where the amount of money coming in does not cover what's going out, okay, then they have to go to the trust fund and take funds out of it. At that point in time, the government has to pay back into that trust fund in order to have the dollars available to pay out in Social Security, okay? Which means that somebody has to pay the piper, and that, quite frankly, is all of us, because we are the deep pockets for the nation, okay? All of our businesses and everything else. So that's basically the situation that we're dealing with, and why it is so important that we deal with this problem now. Let's take a look at the first thing that they say in here, and that is, what's one solution that can be made? Well, if you've only got a very few number of people paying in, one of the ways that you could maybe make sure there's more money in there is if you change the law so that people have to retire later, okay? As I said before, back a number of years ago now, the retirement age was moved up from 65, and it got to 66, and it was to move up to 67, which is about where it is. It's about to go now.
And that's what they call it, full retirement?
Yeah, full retirement. Okay. Again, there is still that option for people to take an early retirement. Raising that full retirement age to 68 by 2028, in other words, moving up a little bit at a time, a month or so at a time, over a period of time, raises the funding gap, or fills that funding gap that we'll run into 15 or so years down the line, fills that funding gap by 18%. So if you just add one more year onto that full retirement age, you can fill about 18% of that gap that's expected to occur. Raising the full retirement age to 70 by 2040 fills that funding gap by 44%. So this is one of the partial solutions that is being suggested by various people in order to deal with that gap that will arise down the road.
Because if I could throw out, they actually have data that shows that at a certain point in time, we're looking at the prospect of not having sufficient workers for all the jobs that, and there are people who say, they're insufficient now, but we've got high unemployment, so, we say, well, that can't be the case. But there is a point, it is said that we will reach years and years down the road where the number of workers will be insufficient, and as a result, what will happen is that more and more of the elder population will be asked to come in and work to pick up some of the slack. But as you have fewer people that are paying into the system and more people that are taking money out of the system, you really have quite a mismatch in terms of what's needed, with more money going out than it is coming in.
Well, there are lots of discussions like that going on out there, and breathing life into those and making sure that they are real is one of the things that has to be done. But at any rate, that's one of the things you can do is to raise the age. Now, what are the problems with that? Some of the problems are we have a lot of folks who go through their life and they work extremely hard, and they wear out their bodies. Okay, for some of them, going from 65 to 67 has not been an easy deal. Okay, moving it up to 68 or 70, again, for those folks who do are involved in kinds of professions that take a toll on the body over time, that could be a disastrous thing in relationship to Social Security. They may end up being disabled and be on Social Security for disabilities long before they would get to age 70. So there are difficulties potentially with that that are recognized and would have to be dealt with somewhat. Now there's another way to deal with this. You know, as we go along in Social Security, there's a COLA, okay, a cost of living adjustment, okay.
Right.
And if inflationary prices are there, then the COLA adds a little bit to what it is that people receive in order to adjust for the inflation. And if it goes down, okay, then you may see nothing in the COLA, which has been in recent years people have experienced. At the same time, they would see their Medicare payments going up, their Part B of Medicare going up in cost, and they would see a check coming in from Social Security and a check going out for Part B, okay, and the deductions between the two, that the adjustment in upwards in the COLA could be more or about the same as what it was already being paid out in order to deal with the inflating costs of Medicare.
I know many people got upset when they only got the 2%, I believe.
Yep.
Yeah.
Right. Yep.
Recently.
Well, the cost of living adjustment provides an annual benefit increase, as we said, to account for inflation, and it's based upon the idea of a consumer price index. Now, there's been suggestion that they switch to what's called a chained consumer price index, and the way that's described is, well, what it does is it factors people's tendency to switch to cheaper products when they have less money, okay, or have less income than they would be purchasing otherwise, and therefore there could be, if it was adjusted to those cheaper products that are out there to determine what the cost of living was, then there could be less of an adjustment in the COLA. That's one of the things that's being suggested. Now, there are other studies that people have done that say, hey, people have already done that. They've already gone from the high price spread to the low price spread, if you will. Okay, and so there are, but that is one of the situations that is being suggested. Now, switching to an elderly price index could be a different thing. And that would factor in the higher expenses that are common when we are older. And those have to do with Medicare, medical costs. The medical costs for those of us who are older tend to be a great deal more than for those of us who are younger. And it's just a part of living.
Yes, yes.
And,
body starts to break down.
and so if you had a COLA that was based upon the differences in the cost for an older person to live, okay, as opposed to when they were younger, you could have a different kind of a COLA. Well, then obviously if you got this one where if you adjusted it so that people were only, it was based upon the lower priced products that a person uses, then that could kind of control the cost, right? Okay. On the other hand, if you went to a COLA that dealt with the real costs that are higher for elderly people, then that could be an increase in the gap, if you will. Okay, so if you had a decrease, if you have the decrease thing, okay, the cheaper products, that could decrease the COLA by 0.3%. Now, what's 0.3%? That confuses people sometimes. If you think about having to multiply something, 0.3% is 0.003, okay, times whatever the amount is, okay, so it's not an awful lot. But that would fill the gap by 23%, which is sizable. And so that's a solution that some people see. On the other hand, there are those in Congress who say, hey, we really ought to be adjusting the COLA so that it deals with the reality of the prices, the costs that senior consumers really encounter. And if they did that, that would increase the gap by 16%. Okay. So this is a problem that's out there, and incidentally, this chained consumer price index, a study was done recently, and I got some information just the other day from AARP, and this has some special impact for veterans as well as just older citizens, okay? And it would mean a tremendous amount of loss of benefits for veterans as a group, let alone seniors in general or those who are simply on Social Security.
Wouldn't want that.
So that's, again, things have their advantages and their disadvantages.
And they're looking at them all.
Yeah. The third thing that they talk about, that various legislators talk about as solutions to it, or to deal with pieces of it, is to tax all salary reduction plans. You know what we're talking about there? Let me give you an example. Before I retired, I was involved for a number of years with colleges and universities as a professor and an administrator. And at the last college that I was at, they took advantage of these salary reduction plans. And let's just put it this way. Say that I had a $10,000 income. But I took a look at my expenses over the year, and I knew that I was taking $1,000 out of my pocket to pay for medical things, okay? I could declare that $1,000, okay, in this program. And by declaring that, okay, I'm still getting $10,000, but I'm declaring that and I'm having to pay for the medical things I have, but I'll only end up paying taxes on $9,000 of income. Okay, so by declaring those things ahead of time, that was a way of avoiding some taxes. Well, that's existed out there for quite some time. And this has to do with, well, if we eliminated that benefit that some people have, but not all people have, and those who have it available to them, not everyone takes advantage of it either. But to, if you will, make a level playing field, that would fill the gap by 10%, okay? So that is seen as one of the things that could be done in order to fill this income shortage that's anticipated down the road.
So they were tax-free and now they would be taxed.
Yeah, right, yeah. Well, then we move on to some other things like increase or eliminate the payroll tax cap. Okay.
Which I favor.
Well, there are a lot of people are, and I guess it depends upon your situation. Whether
those who are making the high
or not.
incomes, salaries, I'm sure, would not necessarily support it. You know, truthfully, when I was in government, and I would, well, yeah, there was a certain point in time where I did reach the cap. And it was good to have that additional money you bring in because it's not being taxed. But when you think about it, you ask yourself, but why am I not paying that? Why are they just capping it at a certain level? Because I knew there were others who were making so much more than myself, and of course they were enjoying that as well. If we're talking about taxing income, then why not just go ahead and tax the income? And I know it's just like with church when you're tithing. When you're making a little bit of money, you don't mind the tithing, right? But when you start making a lot of money, you figure, oh gosh, there's all of this that equates to that 10%. You start thinking twice about tithing. And it relates to a similar thing, I would think, in terms of the higher the income, the more money you then are, because of the cap, bringing home. You want to see all of that money continue to be available to bring home. And when you think about it, what's happening is that the lower income people then, who fall under the cap, are having all of their salary then a part of it, but those who make more are not. They're at a certain point where it's capped and you don't pay taxes on the rest. Or you don't pay, you know, even in terms of the Social Security on the rest.
That's right. You know, it's interesting on the payroll tax cap. Of course, that's increased a lot over the years.
Mhm.
Okay.
Yeah, it's over 100,000 now.
Yeah, it is $110,100. So
Mhm.
the first $110,000 that you earn, you're going to pay Social Security tax.
Mhm.
You know, I can think back to it'd be more than 65 years ago now. Okay. I remember my first job when I was about 12 years old, and it was.
That's about when I started working too, yeah.
It was 35 cents an hour. It would have been a long way to get to 110,000. A lot of hours. Well, it's not that way anymore. But the point is that cap has moved up over the years, and the 110,000 has been there now for a bit in time. And there's been talk about raising it, and it has not got taken seriously. But it is one of the ways that you can increase the amount of money coming into the pot, the Social Security pot, if you will. Would be to tax more of the real income that people receive.
And either by raising the cap or by eliminating it.
And remember, these are wages. These are wages. Okay. Currently, that's 110,100, as we said. Okay. If they lifted that cap to 215,000, okay, so that 90% of all the earnings are subject to Social Security, those taxes would fill the gap by 36%.
Wow, better than a third.
Okay, by taking it from 110,000 to 215,000.
Doubling it.
Well, now you stop and think about the conversation or argument or whatever you want to call it that's been going on recently related to such things in Washington, and you'll recognize how difficult it would be to deal with that for some folks, and but it's there. Now, removing
it would actually affect their income too.
Yeah, it sure would. Removing the wage cap to tax all earnings for Social Security would fill the gap by 86%.
There we have it. Almost a total answer.
Which is what you were talking about before. You were saying, you know, you felt funny when you were not being taxed on part of your income, knowing that the person sitting next to you may be having all of their income taxed. Okay. So, at any rate.
And there's an inequity there if you think about it.
Now, you know, fill it by 36% or 86%.
86%.
And of course, if you pick a different number for the cap in between somewhere, it's adjusted
different impact.
appropriately.
But to eliminate it totally, you're looking at about 86% of the need being met.
Yeah, right. One of the things that has to do with increasing the payroll tax rate, and nobody likes tax increases, as we all know.
Because right now, I think it's around 13%, and the employer pays a certain percentage, and
well, if you raise the payroll tax from the traditional 6.2% to 6.45%, in other words, it's now a little under 13%. Okay? If well, about 12.4, I believe, would be correct. At any rate, if you raise it from the 6.2%, okay, that is paid by the individual to 6.45, okay, percent, and that would amount to $125 a year for an employee earning $50,000. Okay, not an awful lot of extra money a year, but if you did that, that would fill the gap by 22%. Okay, if you, and again, some people are suggesting that this is one of the things to do is to increase that payroll tax rate. If you raise it from 6.2% to 7.2%, or 1 percentage point more, okay, that an extra $500 per year per employee earning $50,000 would be generated And that would fill the gap by 64%.
Sounds like a combination of those two would meet the need. But you know, my issue with this one is that workers then would be paying more, which means they would be bringing less money home, as opposed to the one before where you're eliminating the cap or raising the cap, which just makes the whole system a little bit more equitable for everybody concerned. So you're hurting people more so in this one. I know those that are having more money, making more money would say, yeah, you're hurting me with the other, but this is one where you really would be hurting those who can least afford it.
Think about what happened recently. You know, a couple of years ago, the 6.2% was lowered, okay, in order to put more money into people's pockets, okay, during the recession. And then now it has been eliminated, and so suddenly people are
bringing home less.
Are bringing home less than they were last year. So.
And you know what's so strange is that it was put into place that first year, and then it was extended to the next year. And people never even thought that much about it. They said, oh, I'm seeing more money. But beyond that thought, they didn't realize that it was based on this. And so now that they're not seeing that additional money, they're wondering, well, what happened? You know, what changed that? And hopefully they're being given answers. But very few people actually understood that this was in place.
Now, as I recall, and I could be wrong in this, so I almost hesitate to say it. Correct me if you know that I'm wrong. When you think about that reduction that took place, then obviously not as much money is flowing in, okay, as is flowing out to people who are receiving benefits. But they didn't cut down on the benefits going out.
Right.
They cut down on the flow of dollars in.
Creating even more of a,
And I believe that during one of those years at least, what there was is that there was a shortfall on the amount of money coming in as opposed to what went out, which meant that the federal government had to come up with money, okay, in order to deal with that, which could I don't know for sure where it came from, but it could have come back by paying back into the trust fund, you know, dollars that had been borrowed before, which means that you got to find the dollars from somewhere else. And I heard people complaining, well, they had to go overseas and borrow money from China in order to pay Social Security. Well, maybe from a practical point of view, it could look that way, okay. But the reality of it is that the dollars were borrowed and used here, and we had an obligation to one another to pay those back.
Absolutely.
So,
but it added to the deficit, it sounds like.
You pay the piper, I guess, when it comes down.
Let me take a moment just to say that you're listening to Truth with Gwen Azama-Edwards. My guest, of course, is Bill Ternent, who is an advocate for elders with AARP. And we're discussing Social Security and Medicare, possible alternatives or solutions to the problems that we're looking to face in coming years. And it's better to be really proactive than reactive in terms of that. Even though people have been coming up with some solutions over the years, nothing actually has been done for the most part. There have been some changes, as Bill mentioned early on, Bill, when you talked about the fact that the full retirement age has been raised. You know, that was raised several years back, and there are some other things that have been put into place, but those things were insufficient based upon what we're seeing, which is that because the number of workers receiving funds out of the system has been increasing dramatically, as opposed to the number of persons that are providing funds into the system.
And boomers are arriving
baby
at the age of
boomers
retirement.
like myself, you
Very
know,
quick.
and you know, I read an article once where, WLE 1380 AM on the radio dial, and this is Goliath Radio, and this is stationed in Ormond Beach, Florida. But I read an article, I think a couple of years, maybe 3 years ago, where someone wrote a letter to the editor, and they were coming down on individuals who, when they reached Social Security age, the early age at which they could retire or receive their Social Security, which was 62, And, you know, he was just really just coming on down on them because they took advantage of it, as opposed to waiting till later, you know, to go ahead and draw their pennies. I've had in the past, Bill, individuals who are representatives of Social Security who will continually say to you that Social Security was never meant to be a retirement. It was a supplement. And what is happening in our country is that more and more people are dependent on Social Security as a retirement. And similar for them as a pension, because they don't have pensions with their employers or whatever else. So this actually is for a lot of people filling the gap in terms of helping them to meet their living expenses.
Yep.
In actuality.
Yep.
Yeah, so it's no longer a supplement for a lot of people, a lot of elder individuals. This is their income.
Yes, I had again, a sheet, an analysis that came from AARP recently that was taking a look at seniors and the number of them who are living at or below the poverty line. I don't want to give any figures because I don't have them in front of me, but it is sickening.
Yes, yes, yes.
We have many people who are just hanging on with their fingers.
Absolutely,
And,
absolutely.
And again, as was suggested by the governor, I think, wasn't it today or in his recent thing where he said, you know, as he talked about Medicaid, okay, and the state deciding to accept the Medicaid assistance from the federal government under the new Affordable Care Act.
Right, the expansion of it.
That, and he was saying that, you know, that is absolutely one of the marks of a society is how well it takes care of itself.
Take care of our elderly.
Those who are most needy.
Absolutely, and it's really, I remember Ms. Cusack coming on when she was a part of the House of Representatives, and her statement was that, in fact, as well, that a nation or a people are judged by how they take care of those in truth who cannot take care of themselves, and that's our elderly and our children.
That's true.
So it's both sides of the spectrum as to how we are judged, and people might say how you judge, but in truth, we as a people should care about taking care of those who cannot take care of themselves. In many cases, the elder community, those are persons who have earned that benefit. Most have paid into it, but these are people who have been our mothers, our fathers, our mothers, our grandmothers, our teachers, our social workers, our this, our that. There are people who've been there carrying this country forward. And, you know, there are men and women who have just paid the price, and we really need to do what's right by them. Not thinking in terms of what do they deserve, but I believe every human being deserves to be treated with dignity and respect, and especially during their last days, to not have to be worrying about where the next meal is coming from. And in our country, more and more people are worried about that, and still making a decision between medicine and food.
Yeah. Getting back to Social Security, I think it's another thing that's important for us to always keep in mind. Social Security was never intended to be the total solution for a person in retirement for income. It was never anticipated to be that. And also something that we frequently, you know, we're talking here about people in retirement primarily, but Social Security, a very huge part of Social Security has to do with dealing with survivors. A breadwinner in a family is suddenly gone, and mama's got 4 or 5 or 2 or 3 or whatever number of young children to take care of, and needs to stay at home to do that. And there are funds from Social Security to deal with that survivor benefit.
And all of these things are things that have been tacked on as we've gone forward with Social Security. Disability,
and disability
was not a part of early on.
And disability is another one of those things. And so, Social Security is not
College.
just, it is not just retirement.
Which
Okay.
they don't do anymore, don't
Okay.
they? Yeah.
Let's hit some other stuff here. Benefit improvements. We mentioned earlier people who maybe just plain wear their bodies out because of the kinds of work that they've done all their lives. I remember what some of that